Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
When our kids get sick, as parents, it's often natural to wonder, am I overreacting or am I underreacting? Sometimes your child can have an illness that'll resolve on its own and you feel embarrassed that you even went to the doctor's office because your child is perfectly fine, or you might keep them at home a little bit too long and miss something that was really important. On the next show, I'm going to go over all the different illnesses, symptoms, and severity and help you determine when it's appropriate to seek medical attention and when you're okay just nursing the illness at home. On the next episode of Ask the Doc. Welcome to Ask the Doc, a show where you submit your questions and I will answer them in real time. I'm Dr. Scarlet Constant, board certified pediatrician and founder of Constant Care Pediatrics right here in Miami, Florida. And today, I'm going to help you parents understand the difference between various illnesses, symptoms of allergies, and maybe just a couple of things that you might need to just ignore that are not even that big of a problem. I'm going to help you guide you so that you know when it's best to take your child to the pediatrician or just nurse those illnesses at home. So please submit your questions and I'm happy to answer them. It looks like a question's coming in right now. This question is from Chloe. I've always wondered how to tell if my 2-year-old has a cold, allergies, or if it's something more serious like the flu. I never know when it's an illness that will resolve on its own or if it's something I should see my doctor about. Well, Chloe, that's a great question, and that's what we're going to tackle today. First, let's look at a couple of bullet points. Let's just talk about the difference between these illnesses. A common cold is usually caused by a virus, and the symptoms will last anywhere from 3 to 5 days. Your child will have a stuffy nose or a runny nose, a sore throat, maybe a mild cough, and you just treat those symptoms with basically supportive care, meaning rest, fluids, over-the-counter medications, decongestants, and then the symptoms should resolve within 3 to 5 days, and it shouldn't be that severe. And that's when you know it's a regular common cold. If there aren't any more severe symptoms accompanied with this, then it's okay to nurse that at home. But if we're talking about something a little more serious like the flu, which is caused by influenza, influenza is actually diagnosed in the doctor's office by taking a flu test, and the symptoms can last up to 1 full week. These symptoms are going to be fever. You'll always have a fever when you have influenza. So you have a fever, headache, body aches and pains, weakness, and a lot of times there'll be respiratory symptoms associated with this, which would be a productive cough, chest discomfort, and sometimes you could even develop exhaustion and dehydration. You'll treat this also with rest and fluids and over-the-counter medications, but it is important to see your PCP for this because not only do you need the diagnosis of influenza, but also that will help us direct management. Sometimes there are more complications that occur with the flu than just the symptoms mentioned above. So if you see these symptoms, that's kind of a red flag to go to your doctor, get a flu test, and if the test is positive, then your doctor will guide you and tell you how to further treat your child. Now, if you're wondering about allergies, because sometimes allergies have similar symptoms and you want to know how to differentiate, well, number one, first and foremost, you're not going to have a fever with allergies. Absolutely not. If anybody tells you, well, my child has a fever, it's a little low grade, but it's allergies, that is wrong. You do not have a fever with allergies. The symptoms will last as long as the allergens are present, but remember, the symptoms should only be a runny nose or a stuffy nose, itchy, watery eyes, and sometimes a cough if maybe your child is asthmatic or has some type of respiratory underlying illness, but typically it should really just be a runny nose, stuffy nose, itchy, watery eyes, and sometimes, a transient headache. Without fever, you could safely say this could be allergies. But again, if it lasts more than a week and you feel that the symptoms are not resolving or it's not responding to antihistamines and decongestants, then this is something that you might want to have evaluated further just to confirm whether or not these are seasonal allergies or maybe it could be something a little more serious. It's also important to note that even if it is allergies, when your allergic symptoms are not treated well or they're poorly controlled, it can get complicated into a sinus infection, a respiratory infection, or even worse. So please don't think that just because it's allergies, you don't need to see a physician or you don't need treatment. There are complications that do occur with allergies. I hope that cleared up a lot of misconceptions and helps you with your guidance at home. We have another question coming in from Facebook. Let's take a look. This question is from Melanie. Recently, I have been questioning vaccines for my 2 young children, but am now getting pressured by my husband to get the kids a flu shot. What do you think? Well, Melanie, I obviously advocate vaccines. I definitely encourage you to get your children the flu vaccine. And this is important because the flu vaccine, it does not prevent you from ever getting the flu. You could possibly get the flu even though your child has been vaccinated for it, but it helps at least control the symptoms so that the illness is not so severe as it would have been if your child did not get vaccinated. So the flu vaccine helps prevent getting influenza, but it also helps ameliorate symptoms a lot faster. Sometimes you might just have 1 or 2 symptoms of the flu because you were vaccinated rather than having the full multitude of symptoms. So it's very important to get your flu vaccine, and it is important to get it every single flu season. I encourage you to speak to your pediatrician and find out if they're offering it in the fall. And usually we like to offer the flu vaccine by the end of September, beginning of October, so that your child is fully vaccinated and their defenses are ready for the flu season that's going to start typically in October. If you did miss that window, you can always get your flu vaccine, get your children their flu vaccine during the winter time, and we still vaccinate all the way through spring. So don't feel that because you missed the window when everybody was getting the vaccine that you can't get it later. You can always get it through flu season. I also want to add that if your child has already had the flu, you can still get vaccinated for the flu because there are different strains of the flu and you can get it again. So even though you've been exposed, and yes, that does help fight the flu even better if you're exposed for a second time, there's nothing stronger than the vaccination. So if your child has had the flu, you missed the flu vaccine and you're concerned, you could definitely get the flu vaccine after they have recovered from the flu. Okay, looks like we have a question coming in from our All Health TV app. This is from Madison. My daughter's friend comes over after school a few times a week. I love having her over, except lately she has developed some bad habits like coughing and sneezing and not covering her mouth. Her mother says it's allergies, but I'm not sure. Am I overreacting? Can you provide some tips that I can casually share? No, Madison, you are not overreacting. Just from a hygienic standpoint, it is not good to cough and sneeze without covering your mouth. Coughing on people, spitting on people, sneezing on them is never okay, whether it's due to allergies or an infectious illness. I think that we can all agree, especially after COVID, that there's nothing okay about doing that. Now, if it is just allergies, great. At least that just means that this child is not infectious. But again, this child needs to practice proper hygiene by washing their hands, covering their mouth when they cough, covering their nose when they sneeze, and blowing their nose and wiping and washing their hands afterwards. And I really don't think there's anything wrong with speaking to the parents about this and just remind them that their child does not have the habit of practicing good hygiene and that they might need to talk to her about it. I think that's completely acceptable, especially if she's going to be at your house around your children. And while she's in your house, there's nothing wrong with telling her to please cover her mouth or cover her nose. It's not embarrassing and it shouldn't be offensive, especially if she's in your home. You totally have the right to suggest it. So we have a lot of questions coming in. This seems to be a bit of a hot topic. Here we have a question coming in from Instagram. It's from Keith. My son always seems like he's sick. When we went to our pediatrician, she said it could be allergies and we should come in for tests. Can you tell me what those tests are like? Okay, so if your child, it seems like your child seems to have allergic symptoms, which might be confused for being sick all the time. So if your pediatrician does believe it could be allergies, meaning seasonal allergies, environmental allergies, or maybe even food allergies, then what they will typically do, usually what we do is a screening test. And the screening test is done by drawing blood and ordering an environmental, or what we call a respiratory allergy panel, and a food allergy panel. And the respiratory allergy panel is going to be specific to the area that you live in. And this is it's quite interesting. You can actually test for the most common environmental allergens that are in your area. So the grass that grows where you live, the trees, the different types of bugs that might be around, such as cockroaches and certain insects, and even the dust mites and molds that are present in your area. So if you're coming in from out of town or visiting family and end up going to a pediatrician and getting testing done, you want to remind the physician as to where your child lives permanently so they can order the test for that region rather than our local area. So that's our screening test. And if there are some allergens that come up positive, what will happen is your child would then be sent to an allergist, and the allergist will confirm that testing by doing what's called a skin test. And that's where they actually take the extract from these allergens, they're just liquid, and they actually dab it on to your child's back or arm, just an open area of skin. They dab the extracts on and then wait about 15 minutes to see if your child has a skin reaction to those allergens, which would be in the form of a hive. So it's not painful. It's just that if your child does have a positive reaction, your child might have a couple of hives on their back or their arm, wherever the extract was placed. And that will confirm the positive to these allergens. So to repeat, it would be a blood test and a skin test, or either or some physicians might send you right to the allergist, skip over the blood test and go straight to the skin test, which is going to be the extract dabbed onto the skin. And I just want to remind you, some people think these are shots that you get all over your body. They're not shots. It's literally, you dab the liquid extract onto the body and wait for the skin to have reaction, which would be a hive. And then if those are confirmed positive, the allergist and your pediatrician would move forward on deciding how to manage the allergic symptoms. So good luck to you and your son. It looks like we have another question coming in, and this is coming in from our Facebook page, and it's from Monica. Can you explain the difference between a viral infection and a bacterial infection? Monica, that's a great question. So there is a difference between the two, and I will say this. Please don't try to distinguish between the two at home, because either way, your child has to be seen by a physician in order to appropriately manage these infections. So while it is great to understand the difference between the two and be on the same page as your physician when they treat, I do encourage you to make sure that you still bring them to the pediatrician to discern the two, okay? So let's start with a bacterial infection. A bacterial infection, usually your child will have thick secretions and sometimes even malodorous secretions. So unlike the viral infection that you just have like this watery runny nose, with a bacterial infection you start to notice that the nasal secretions are quite thick and they are quite malodorous and sometimes have a color to them. A bacterial infection will definitely last more than the 3 to 4 days that you'll see with a viral illness. And with a bacterial infection, you'll usually spike a fever, and the fever would be persistent. Whereas with a viral illness, you might have 1 or 2 days of fever. With the bacterial, it will persist for each day that you are infectious. Whereas with the viral infection, there are different types of bacterial infections. Pneumonia is a bacterial infection. Ear infections tend to be bacterial. Sinusitis, an upper respiratory tract, a urinary tract infection. These are all examples of bacterial infections, and these are examples of infections that we would treat with antibiotics. If you have a urinary tract infection, that is not something that we let resolve on its own. It is a bacterial etiology, so we treat with antibiotics. Sinusitis is, of course, a bacterial etiology, and we treat with antibiotics. This could be even a complication, like I mentioned before. If you have allergies or allergic symptoms that are lasting too long, they can get complicated. A bacteria will grow out and cause sinusitis. So these are very common types of infections that are caused by bacteria, and therefore we will treat with antibiotics. Viral infections are usually will present with respiratory symptoms such as a runny nose, a cough, maybe a headache, some nasal secretions, sore throat. You'll have body aches, headache, and plus or minus a fever. Sometimes a fever, maybe not, or maybe just a fever one day. And that's usually what will happen with a viral infection. So you'll have malaise and fever, and the symptoms will last up to 4 days. Once you pass the 4 or 5 days, maybe we're thinking that this could be a bacterial infection versus viral. But again, it's not black and white, which is why I encourage you to see your pediatrician first. Types of viral infections will be your upper respiratory infection like coronavirus, rhinovirus, influenza. Those are all viral infections. Acute gastroenteritis, which is vomiting and diarrhea. Those are caused by the norovirus and the rotavirus. These are all infections of viral etiology. And basically, it's important to know whether it's bacterial or viral, again, due to treatment. And viral infections, for the most part, we treat by supportive care. And what that means, supportive measures means we just treat the symptoms. There isn't a specific medication that we give to get rid of the virus. We just treat the symptoms and we let the virus resolve on its own. So we have some more questions coming in. Let's take a look. This question is from Angie. One of my daughter's classmates came down with hand, foot, and mouth disease. I've heard of it before, but I don't really know what it is. Can you explain what it is and what I need to know, please? Okay, Angie, hand, foot, mouth. It is a viral illness. Hand, foot, and mouth is a disease caused by the Coxsackie virus, and it causes red pustular lesions within the mouth, on the palms of the hands, and on the soles of the feet. Therefore, it got its name, hand, foot, and mouth disease. You don't have to have sores in all three. You can have sores just in the mouth, just on the hands, just on the feet, or any type of combination of the three. And it comes with fever, with sometimes headache, malaise, mild URI symptoms, but most importantly, the lesions. And the lesions are red, they are painful, they are itchy, and they burn all at the same time. A lot of times the younger kids will get a little bit dehydrated because the sores in the mouth are painful and it's difficult for them to eat and drink. So sometimes they suffer from dehydration if they are not hydrated adequately. Definitely it's hard to eat because of the pain in the mouth. And sometimes the fever might make the kids feel a little bit tired and just not wanting, just a little bit more fussy than usual. So hand, foot, and mouth is contagious. It's very contagious, and it's actually passed along by the secretions, meaning by the saliva, or if there are any nasal secretions, it can be passed that way. But for the most part, the younger kids tend to drool a lot because of the mouth sores, and that is where they are passing the virus. A lot of people believe that the actual lesions are contagious. If you touch the lesions, they are not, that will not give you the infection. They are not contagious. Again, it is the secretions. Hand, foot, and mouth, you are contagious while the child is febrile. So if they have been afebrile for 24 hours or more, but the lesions are still present, they are not contagious. They are no longer contagious. Usually the infectious part is about a week before the lesions appear. So a lot of times the children have been exposed to each other before they knew that the child even had hand, foot, mouth. So it does spread through daycares and younger classrooms a lot faster and a lot more. It's a lot more prevalent in the younger age group than in the older age group. It does resolve on its own. You just treat the symptoms, meaning the pain in the mouth, the fever, the itchiness, or the discomfort. You want to hydrate as much as possible, but that is it. The treatment is just supportive measures. I hope good luck with your daughter. Okay, it looks like we have another question coming in, and this is from YouTube. It's from Robin. My mother-in-law's immune system is very weak. My daughter is 2 and is in preschool, and I want her to see her grandma. With all of the germs at preschool, is it dangerous to bring her around my mother-in-law? Well, yes, your daughter is definitely going to school in what we jokingly call a petri dish. She's exposed to many other children that have various viral infections at various stages of infectivity. So we never really know if she's exposed or just got over something. And absolutely, it is risky to expose her to your mom who has who is immunocompromised. If in fact she is immunocompromised, I would be very careful. It just depends on what condition your mom has and how much exposure you really want to give her with your granddaughter. I mean, I know it's important for families to be together and for her to bond with her. So I think that you just have to be vigilant and proactive and understand like where your daughter is in an illness. I think if your daughter's completely asymptomatic and hasn't been sick at all, it's okay to expose her to your mom, but if your daughter has any type of symptoms of runny nose or a little cough or is just getting over an illness, or maybe she has a friend that's getting over an illness, that's when you want to be a little more careful and just make sure you have a good long 1 week window where there haven't been any symptoms or any new occurrences in the classroom, and then take it from there to expose her to your mother. But I know it can be tricky, and I would speak to your pediatrician to advise you on the best way to go ahead and have the two of them together. Hi. So we have another question coming in, and this question is from Avon. When I was young, my mother always used to put alcohol on my feet and then socks to help bring down the fever. Was that an old wives' tale, or is there something to that? Well, Avon, yes, my parents did the same thing to me. Alcohol on the feet, Vicks on the chest, and they want you to just sweat out that fever until it goes away. So let me tell you a little bit about the basis behind that. The idea is you want to lower the temperature in the body, right? And so in order to do that, you definitely don't want to bundle up and wrap someone up and get them warmer, even though you feel cold. The natural instinct is to warm up your child and put on a blanket. That is not the right thing to do, because you're just going to elevate the core body temperature even more. So the idea with the alcohol is kind of like to evaporate and release the heat from the body. Heat escapes our body in the hands and the feet and the head. So the idea was maybe to facilitate the heat leaving the body to drop the temperature down. That was the theory. There is not much evidence behind that. It doesn't hurt to do it, but don't think that that's going to lower the fever. To lower the fever, you want to hydrate. That's very important, is give your child cool beverages. You could bathe your child, not with a cold bath, because I know some people think give a cold bath to shock them or bring down the temperature. Absolutely not. You just give them a normal bath, because again, heat leaves the body and travels much faster in water. So if they're sitting in an ice bath, their body temperature will naturally drop down. So you can give them a bath, put them in, you want to hydrate them, you want to put them in loose, cool clothing. And if that is not lowering the body temperature fast enough or at a reasonable rate, then of course you'd want to give antipyretics, meaning Tylenol or Motrin, to lower the fever. I just want to remind you that these are all things to help lower the body temperature. Lowering the body temperature or getting rid of the fever does not equate to fighting the illness. And I think that some people get a little confused with that. They think if I get rid of that fever, then they're getting better and I'm getting rid of the illness. The fever is just a sign. It's like an alarm. It's a siren telling you that there is an illness. So while you want to control that temperature just to keep your child comfortable, and of course so that they don't overheat, you're still not managing the illness. So please keep that in mind. I think we have time for one more question. Let's take a look. Mickey says, when my kids were young, I was told to use a vaporizer or humidifier when they were sick. Now that I'm a grandparent, should I suggest my daughter use one for my granddaughter? Yes, so the vaporizer or the humidifier is great when you have nasal secretions. If your child is having difficulty breathing due to nasal congestion, not chest, but nasal, or it's hard for them to clear their nasal passageways, the humidifier is really great to help moisturize the nasal passageways and help prevent that irritation while they're sleeping at night. So it's a comfort measure, but it is not going to treat the illness. I hope that helps. Thank you for all of your questions. This was great, and I hope this helped you with your management of your children and help really determine what's going on at home. I'm Dr. Scarlet Constant, board-certified pediatrician and founder of Constant Care Pediatrics here in Miami. Thank you for joining us on the show. We'll see you next time.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.